Welcome back, everybody. This is Laura Mitchell reporting to you live from the Digital Health Summit studio here at CES 2016, and I'm here with the CEO of WellDoc, Kevin McRaith. Welcome to the show.
Thank you. Nice to be here.
Nice to have you. So tell us a little bit about some of the things WellDoc is doing.
So WellDoc, it's a very exciting time for us. We actually are almost done with our Series B. We've recently raised $22 million.
Wow, congratulations.
And Samsung, along with Merck Global Health Innovation Fund, has led our Series B. So we're really excited to work with Samsung and continue to work with Merck.
That's fantastic news, and it's also inspirational to see this industry really moving forward, you know, as a whole. It's inspiring and encouraging for sure. So tell us, what does WellDoc do?
So WellDoc's a digital health company, and what we do is we utilize technology to really enhance patient engagement through technology to increase outcomes.
Okay.
And ultimately to decrease costs in the healthcare system.
Okay, so tell us what that looks like. Are they going on a smartphone, or how are they accessing WellDoc?
Yeah, so WellDoc is a great story for digital health and M-Health. We weren't just discovered a year ago. We've actually been around 10 years.
Fantastic.
And WellDoc has followed a life science model. And you may say, what does that mean? Well, we've actually done clinical trials on our product from back in our inception. And what we did was we utilized our product, which to your point is on a smartphone, tablet, and we also have a web-based version. But we've utilized our product in clinical trials. And the clinical trials showed that our product offered a significant reduction for patients with type 2 diabetes. Our studies have been published in peer-reviewed journals, and then we received, which is also very unique, clearance by the FDA as a Class 2 medical device. And ultimately, we received what's called an NDC code, where you're like,
right, sure.
What's that? But actually, that allows us to be reimbursed, which is part of our entire business model.
Well, and that's so critical. And I think, you know, there's an influx of all sorts of new companies, which is encouraging because it's showing us that the market is ready and the space is rapidly growing. But I think what people don't realize is how complex the human body can be. So having that decade of experience really comes into handy, because at the end of the day, it has to actually work. It has to really do the things that you've said it does.
No, that's a key point. I think ultimately, to your point, there's so much noise and so much activity right now in digital health and M-Health. But ultimately, what's going to be most important is what kind of outcomes do you see with your product? What's your business model? And are you going to be able to get reimbursed by a payer?
Well, absolutely. So where do you see WellDoc going in the next year?
We're excited. You know, so as I said, we just completed our Series B fundraising. Yeah. But what we've done over the previous year was we did a regional demonstration project, and we really wanted to understand, when we walk into a doctor's office, do they see value in our product? Secondly, we wanted to learn, how do patients engage with our product, but more importantly, how does it perform in the real world? And so we've done that over the past 12 months on really a concentrated basis with payers, with patients, and with healthcare providers. And now with our new funding and new investors, we're going to be scaling on a national level.
That's wonderful news. So tell us, how do we find out more information about WellDoc? Where can we find you?
We have a website called welldoc.com, and please reach out to us there.
Well, excellent. Thank you so much for joining me. This is Kevin from WellDoc, and I'm reporting to you live from the Digital Health Summit studio. Laura Mitchell from CES 2016.